Welcome, everyone, to the TheEMTSpot's Blood Pressure Podcast. I'm Samuel Harrison, and I'm excited to jump into a topic that hits close to home for a lot of people.
I'm Olivia Harper, and you're absolutely right. We're talking about chronic hypertension, and there's so much to unpack here.
Okay, so chronic hypertension,
hmm
is that like when your teenager refuses to clean their room?
Not quite, but I like where your head's at. It's actually often called the silent disease.
Silent disease. That sounds kind of ominous. What's the deal with that?
Well, it's called silent because often there are no noticeable symptoms. People can have high blood pressure for years and be totally clueless.
So like a ticking time bomb.
You could say that, and that's why regular blood pressure checks are so important. We're talking about nearly 50% of adults in the U.S. meeting the criteria for hypertension.
Well, hold up, 50%? That's like almost half the adult population.
Mm.
So what kind of risks are we looking at here with hypertension?
It's serious stuff. According to expert Paul K. Welton, having hypertension doubles your risk of cardiovascular complications. Things like heart attacks, strokes.
Double the risk. Okay, yeah, that got my attention. So we know checking our blood pressure regularly is key, especially if hypertension runs in the family. But let's break it down. What do those numbers on the blood pressure reading actually mean?
Right, so a normal blood pressure reading is less than 120 systolic and less than 80 diastolic. You know those top and bottom numbers you see?
Systolic's the pressure when your heart beats, and diastolic is when it's relaxing between beats.
Got it. What happens when those numbers start creeping up?
So if your systolic is between 120 and 129, but your diastolic is still under 80, that's considered elevated blood pressure, sometimes called pre-hypertension. It's not full-blown hypertension yet, but definitely something to keep an eye on.
Like a yellow flag, heads up.
Exactly. Then you have the actual stages of hypertension.
Mhm.
Stage 1 is a systolic between 130 and 139, or a diastolic between 80 and 89.
Okay, and stage 2?
Stage 2 is more serious. Systolic jumps up to 140 to 180, or a diastolic of 90 to 120.
What if the numbers go even higher than that, like past 180 or 120? That's a hypertensive crisis. It's a medical emergency. You need to seek help immediately because it can lead to some serious complications.
Okay, noted. Definitely want to avoid that. So we talked about blood pressure stages, but what about the different types of hypertension?
There are two main types: primary hypertension, also known as essential hypertension, and then there's secondary hypertension.
Okay, lay it on us. What's the difference?
Well, primary hypertension is the most common one, and it's not caused by one specific medical condition. It's more like a combination of factors.
What kind of factors are we talking about?
Think genetics, age, race, and really importantly, lifestyle choices. Things like lack of exercise, too much alcohol, a diet high in sodium, being overweight or obese.
So our lifestyle choices really do play a big role.
Absolutely. Making healthier choices can significantly lower your risk. Now, secondary hypertension is a bit different.
How so?
It's usually caused by an underlying medical condition or sometimes even certain medications.
So things like kidney problems, thyroid issues, adrenal gland disorders, even sleep apnea.
Exactly. You got it. Endocrine tumors can also lead to secondary hypertension.
So it's like secondary hypertension is a symptom of a bigger problem.
That's a good way to think about it. You have to find and treat the root cause.
Makes sense. So let's say someone thinks they might have hypertension. What's the first step to getting a diagnosis?
The first step is a simple blood pressure measurement using a sphygmomanometer.
And you can get that done at your doctor's office, a local pharmacy, even at home if you have a monitor.
Exactly.
The one high reading and bam, you're diagnosed.
Not so fast. It actually takes more than one reading to confirm a diagnosis. You see, blood pressure can fluctuate throughout the day. Stress, anxiety, all sorts of things can affect it.
So you might just be nervous at the doctor's office.
Exactly, white coat syndrome, as they call it. That's why you need multiple readings over time to really get an accurate picture.
Okay, so multiple readings are key, but what happens if those readings consistently come back high? What's next?
Well, if you're seeing those high numbers again and again, your doctor might suggest some further diagnostic test.
What kind of tests are we talking about?
Things like blood tests to check your cholesterol levels, an electrocardiogram or EKG to see how your heart's electrical activity is looking, and maybe even ultrasounds of your heart or kidneys to check for any structural abnormalities.
So basically ruling out other issues and seeing if there's any damage from the hypertension.
You got it. It helps your doctor pinpoint the cause and figure out the best treatment plan.
Okay, that makes sense. And speaking of treatment, honesty is the best policy when talking to your doctor, right?
Absolutely. You've got to be upfront with your healthcare provider about everything. Your medical history, family history, lifestyle, any medications you're taking.
Why is all that so important?
Because it helps paint the full picture. It allows your doctor to make an accurate diagnosis and come up with the most effective treatment plan. Personalized care is key.
Okay, so let's talk treatment. What does tackling chronic hypertension actually look like?
Well, if it's secondary hypertension, the first thing you do is treat the underlying cause. But sometimes, even after treating the cause, high blood pressure can stick around.
So what happens then?
Well, in those cases, your doctor might suggest complementary therapies and lifestyle modifications to help manage your blood pressure.
And I imagine the treatment plan might change over time.
Absolutely. It's not a one-size-fits-all thing. Your doctor will work with you to adjust the plan based on your individual needs and how your hypertension is progressing.
Gotcha. So what about medication? What are some of the common medications prescribed for chronic hypertension?
There are a few different types that can help lower blood pressure.
Like what? Give us the rundown.
Well, you've got diuretics, sometimes called water pills. They help flush excess sodium and fluids from your body. Then there are ACE inhibitors. They basically block a hormone that constricts blood vessels.
And ARBs, I've heard of those.
Right. ARBs work in a similar way, blocking the action of that same hormone. And finally, there are calcium channel blockers. They relax the muscles in your blood vessels.
So finding the right medication, or maybe a combination of medications, sounds like it could take some trial and error.
It can. It often takes time to find what works best for each person. Your doctor will look at your overall health, how severe your hypertension is, potential side effects, any other medications you might be taking.
That's a lot to consider. What's the most important thing for people to remember when it comes to navigating hypertension medications?
Open communication with your doctor is absolutely crucial. Before starting any new medication, talk about the potential risks and side effects, and make sure your doctor is aware of any existing medical conditions or treatments you have. It's a team effort.
That's really great advice. So medication is one part of it, but what about lifestyle changes? Do those play a role in managing hypertension?
Lifestyle adjustments can make a huge difference when it comes to controlling blood pressure.
What kind of adjustments are we talking about?
Things like maintaining a healthy weight, following a balanced diet that's low in sodium and saturated fat, getting regular exercise, limiting alcohol intake, and if you smoke, quitting.
So even small changes can have a big impact.
You bet. And in some cases, these lifestyle modifications can actually reverse hypertension completely. You might not even need medication.
Now, that's what I call taking control.
Yeah.
It sounds like we have more power over our blood pressure than we realize, just by making smart choices in our daily lives.
Exactly. Taking care of your blood pressure is honestly one of the most important things you can do for your overall health and well-being.
Well, that brings us to the end of this part of our deep dive into the diagnosis and treatment of chronic hypertension. I don't know about you, but I'm feeling pretty empowered already.
Me too. It's amazing how much we can learn about our health just by understanding how to manage our blood pressure.
We'll be back in just a moment with more insights and expert advice, so don't go anywhere.
We were talking about lifestyle adjustments and how they can have a huge impact on managing blood pressure.
Yeah, it's amazing how much power we have to improve our health just by making changes to our daily routines.
Exactly. It's like having a secret weapon against hypertension. And the best part, these lifestyle changes are beneficial for everyone, even if you don't have high blood pressure.
Okay, so let's dive in. What are some specific changes that can help lower blood pressure?
First up, let's talk about weight management. Maintaining a healthy weight is one of the most effective things you can do. Even losing a small amount can make a difference.
It's like taking some of the pressure off your heart, literally.
Exactly. Next up, we have diet. What we eat impacts our health in so many ways, and blood pressure is no exception. Aim for a balanced diet that's low in sodium and saturated fat.
So basically less salt, less processed foods, more fruits, veggies, lean proteins, whole grains.
You got it. And speaking of good stuff, let's not forget about exercise. Getting regular physical activity is crucial.
Time to get moving. What kind of exercise are we talking about?
Anything that gets your heart pumping. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Brisk walking, swimming, cycling, dancing, whatever you enjoy and can stick with.
Find what you love and make it a part of your routine.
Exactly. Now, another important factor is alcohol intake. While moderate consumption might be okay for some excessive drinking, can definitely raise blood pressure.
So moderation is key.
Absolutely. And finally, we can't talk about lifestyle changes without mentioning smoking. Quitting smoking is hands down one of the best things you can do for your overall health, including your blood pressure.
It's amazing how much our bodies can benefit when we eliminate those unhealthy habits.
It really is. And even small changes can add up to big improvements. It's all about taking those first steps.
So we've talked about lifestyle modifications and medication, but what happens when high blood pressure is caused by something else entirely?
You're talking about secondary hypertension. Remember, this type is caused by an underlying medical condition or certain medications.
Exactly. So how do we tackle secondary hypertension?
The first step is to identify and address the root cause. This might involve treating a kidney problem, adjusting medications, or addressing sleep apnea.
Like detective work.
Exactly. And once the underlying cause is under control, blood pressure often improves. However, in some cases, high blood pressure might persist even after treating the cause.
So what do we do then?
In those cases, we might use the same lifestyle modifications and medications that we use for primary hypertension. It's about finding the right approach for each individual.
So it sounds like a more holistic approach is needed when treating secondary hypertension.
Absolutely. It's a team effort between the patient and their healthcare provider.
Earlier, we talked about honesty and open communication with your doctor. Why is that especially important when it comes to managing hypertension?
Well, it's crucial for several reasons. First, your doctor needs your complete medical history to make an accurate diagnosis and recommend the right treatment. This includes any other health conditions, medications you're taking, even over-the-counter meds and supplements.
Full transparency.
Exactly. It's also important to be honest about your lifestyle, your diet, exercise habits, alcohol consumption, smoking status. This helps tailor a treatment plan that fits your needs.
It's about giving your doctor all the pieces of the puzzle.
Exactly. And finally, be upfront about any challenges you're facing with treatment. Side effects from medication difficulties, sticking to lifestyle changes. Your doctor is there to help you find solutions.
Working together as a team.
Exactly. Now, you mentioned side effects earlier. What are some common ones people might experience with hypertension medications?
Yeah, that's a good question.
Well, it varies depending on the specific medication. But some common side effects include dizziness, fatigue, headaches, upset stomach. Some medications can also have more serious side effects, although those are less common. Talk to your doctor about any side effects you're experiencing so they can adjust your medication or dosage if needed.
It sounds like some trial and error is normal when starting a new medication. The key is to stay in communication with your doctor.
You got it. And remember, managing hypertension is a lifelong journey. It's about sustainable lifestyle changes and working closely with your healthcare provider to control your blood pressure and reduce the risk of complications.
It's about taking control of your health and making choices that support your long-term well-being.
Absolutely. And with the right information, support, and a little bit of effort, you can live a long and healthy life, even with hypertension.
Well said. Now, we've covered a lot of ground today, from understanding the different types of hypertension to exploring various treatment options. But before we wrap up, let's touch on some of the latest advancements in hypertension research.
There's always something new to learn. One area that's particularly exciting is personalized medicine for hypertension. Scientists are working on ways to tailor treatment based on individual genetic makeup and other factors.
Wow, that's incredible. Personalized treatment plans.
Exactly. Another exciting area is focused on new drug targets. Researchers are looking for new ways to lower blood pressure without causing unwanted side effects.
More effective and targeted treatments.
Exactly. And there's also a lot of research being done on the role of lifestyle interventions in preventing and managing hypertension.
The power of lifestyle changes.
Exactly. Researchers are studying the impact of various diets, exercise programs, stress management techniques, and other lifestyle interventions on blood pressure. They're also figuring out how to best support people in making and maintaining healthy changes.
Empowering people to take control of their health.
Exactly. The future of hypertension research is bright, and I'm excited to see what new discoveries and innovations emerge in the years to come.
Me too. It's amazing to see how far we've come in understanding and treating this silent disease.
It really is. And with continued research and innovation, we can continue to improve the lives of people with hypertension and help them live longer, healthier lives.
That's a great note to end this part of our deep dive on. We'll be back in just a moment to wrap things up, so stay tuned. Welcome back to the TheEMTSpot's Blood Pressure Podcast. We've covered a lot of ground today, haven't we? From understanding what blood pressure is to how we diagnose and manage it.
It's been quite a journey. We've explored the causes, the risks, and even touched on some of the latest research on personalized treatments.
And don't forget the power of lifestyle changes. Those small adjustments to our diet, exercise, and habits really can make a big difference.
Absolutely. It's all about those daily choices. Empowering ourselves to take control of our health.
I think one of the key takeaways here is the importance of talking openly with your doctor. It's about working together as a team to find the best treatment plan.
Couldn't agree more. Honesty and open communication are crucial for managing hypertension effectively.
And it's inspiring to see how science is always moving forward, finding new ways to manage and treat this condition.
Absolutely. The future of hypertension research is bright.
Well, that about wraps up our deep dive into chronic hypertension. We hope you found it informative and helpful.
It's been a pleasure sharing this information with you.
And remember, this is just the start of your journey to understanding and managing your blood pressure. There's so much more to learn, and your doctor is always there to guide you.
Don't hesitate to ask questions. Advocate for your health and make informed choices. It's your health.
For all of us here at the TheEMTSpot's Blood Pressure Podcast, I'm Samuel Harrison.
And I'm Olivia Harper.
Thanks for joining us today. And don't forget to subscribe to our channel for more deep dives into blood pressure and heart health. We'll be back soon with more insights, tips, and expert advice. Until then, stay well and keep those blood pressure numbers in check.